Focal nodular hyperplasia is congenital vascular lesion and it is composed of normal liver elements. Some of the elements which comprises normal anatomical structure of the liver like hepatocytes, bile ducts, Kupffer cells and some of the intervening septa. So this is composed of all these elements. Only one element of the liver architecture is missing, that is absent portal tracts. Sometimes it may get enlarged and also responds to hormonal stimulation, particularly oral contraceptives, and this is the second most common benign hepatic tumors. As it is responsive to the hormonal stimulation, so usually seen in the women's and especially in their reproductive life. For focal nodular hyperplasia clinical presentations are concerned, majority of the cases happens to be asymptomatic and they would be an incidental finding either on ultrasound or CT scan. Sometimes it may give rise to pain or there may be hepatomegaly. Most commonly seen in women between the age of 20 to 50 years of age. There are certain characteristic features of focal nodular hyperplasia on the ultrasound imaging, on the non-contrast enhanced CT and contrast enhanced CT. However, MRI play an important role for the detection of focal nodular hyperplasia. Scintigraphy also play an important role for the detection of this benign nodule, and DSA can also be done. So let's start watching images for the ultrasound and for the contrast or non-contrast CT scan, how this focal nodular hyperplasia will appear on these images. On the ultrasound, focal nodular hyperplasia has non-specific features and it demonstrating similar reflectivity adjacent to the liver parenchyma, but sometimes it may show mass effects. Central scar may also be seen. Look for these two images. On these two images there is slightly echogenic mass can be seen on the right side and also on the left side, but there is difference in the sizes. Both are focal nodular hyperplasia. Another important feature to have a look to, that is central scarring. Centrally there is hypoequic area which represent central scarring. This lesion is comparatively larger than the previous one. It is also echogenic. Margins of the liver, margins of the lesion are smooth. It is within the liver parenchyma, particularly in the right lobe, so you can easily differentiate between the lesion and the liver parenchyma. Sometimes this lesion will appear as isoequic. It will become difficult to pick on the ultrasound imaging, but if you are expert enough and you have seen all these images of focal nodular hyperplasia previously, so you won't miss that. The important characteristic of focal nodular hyperplasia is central scar. You can pick in some of the images in some of the lesion, but sometimes this may not be visible. So as in this case, you cannot appreciate the central scar. This is another focal nodular hyperplasia example indicating by the black arrow. Look for the liver. Liver is slightly echogenic. It means this is fatty liver. Within the fatty liver, this hypoequic lesion is focal nodular hyperplasia. If you concentrate, you may be able to appreciate central scar. Within the center, there is central scar is visible. However, there is difference in echogenicity. So this is focal nodular hyperplasia. If you concentrate, margins of the liver, margins of the lesion are smooth, rounded. There is no interruption. This is space occupied lesion and this is focal nodular hyperplasia. There is no central cystic degenerative changes. There is no echogenicity. There is no calcification in it. So this is focal nodular hyperplasia in the right lobe of the liver. So compare with other clinical information and the patient history as well. This is another example of focal nodular hyperplasia. This is transabdominal scan and this slide shows liver. However, the parenchyma of the liver is not clearly visible because of the large size of focal nodular hyperplasia. This FNH is appearing as hypoequic with a central isoequic scarring. So scar is also available. This is a large tumor. This is a large mass occupying the right lobe of the liver. There is central scarring present. However, there is no calcification. Margin of the lesion are smooth. There is no irregularity. There is no other abnormality in the visible liver parenchyma. So this is another example of focal nodular hyperplasia. CT play an important role for the detection of focal nodular hyperplasia, especially whenever there is space occupying lesion. There are certain investigations related to computerized tomography is available. You can straight away jump into non-contrast enhanced CT and contrast enhanced CT. Triphasic CT especially used for the classifications of the space occupying lesion. This image shows a slightly hyperdense lesion involving in the left lobe, almost protruding out of the left lobe. Margins are smooth, margins are regular, but within the lesion there is a hypodense scarring. So this is what the characteristic of focal nodular hyperplasia. So the round lesion slightly hyperdense with internally or centrally hypodense scarring. Look for this image. This is non-contrast enhanced CT and liver is slightly enlarged, hepatomegaly is there, but within the lesion, within the right lobe, denoting by M, it is a mass. This is focal nodular hyperplasia. This is isodense, so you cannot easily appreciate, but if you focus and if you look for the surrounding vascularity or portal and hepatic veins which is slightly displaced because of the mass effect. So this is a focal nodular hyperplasia and it appears as hypodense lesion. So this hypodense lesion setting within the right lobe of the liver. Surrounding vasculatures are displaced. Within the mass lesion you cannot appreciate any scarring or any other signal changes, or there is no signal changes within the liver. So this is another example of focal nodular hyperplasia which required attention for the diagnosis. Another classical example on the contrast enhanced CT. Here you can appreciate liver appears normal. This is axial images of the computerized tomography, and contrast enhanced CT. Liver shows normal uptake, while so far the lesion is concerned, this focal nodular hyperplasia shows contrast uptake with a central well-defined hypodense scarring. This black arrow is indicating scarring. So scarring is present. Margins of the lesion are smooth. There is no irregularity. There is mass effect on the liver. Particularly this lesion is setting in the left lobe, slightly protruding out of the left lobe. This is an example of focal nodular hyperplasia. Another same characteristic lesion, focal nodular hyperplasia, has been shown on this axial images of the CT. Margins are smooth, margins are regular, round in shape, hyperdense lesion with central hypodense scarring indicated by this black arrow. So this is another example of the focal nodular hyperplasia. Focal nodular hyperplasia is a characteristic, as I mentioned earlier, that they will be central scar. Whether you are doing ultrasound or you are doing CT scan, in both condition, in both radiological imaging, you may be able to see internal scarring in majority of the cases. And second thing, this is usually related to hormonal receptions, like there will be contraceptive history as well. So this is focal nodular hyperplasia. Look for this another image. It is quite bright and the contrast has been taken up by the focal nodular hyperplasia. Beside this, hypodense scarring is also visible. Very clear example, nobody can miss that. But there is one another important feature, that you have to differentiate it from other space occupying lesion. Some of them may be malignant, some of them may be benign. I will discuss later, but this is an example of focal nodular hyperplasia with central scarring. Scintigraphy is also playing important role to differentiate between normal and abnormal and benign and malignant tumors. Sulfur colloids can be used for the detection of focal nodular hyperplasia. It appears normal because of the Kupffer cell activity. There is a Kupffer cell activity, as I mentioned, that focal nodular hyperplasia is composed of certain liver elements including bile ducts and Kupffer cells and some fibrous tissue. Because of the presence of the Kupffer cells, sulfur colloid appears normal. So this also play an important role for the detection. When you do ultrasound and do CT scan, after that what comes is scintigraphy, and on the scintigraphy this lesion will appear normal. On DSA imaging, as it is a vascular mass, so vascular mass with a large tortuous central supplying artery, so you will be able to see central supplying feeding artery, and that is a characteristic of focal nodular hyperplasia. So focal nodular hyperplasia can be confirmed on CT images, on ultrasound imaging, and then scintigraphy will show that the lesion is normal. It takes normal sulfur colloid, while on DSA there will be a large tortuous central supplying artery, which is the confirmation of focal nodular hyperplasia. Whenever you are looking for the space occupying lesion and with a central scar, there must be differentials. Always look for that. The first comes is hepatocellular carcinoma, and it may be similar to hepatocellular adenoma. Hepatocellular adenoma has the characteristic of having central scarring and hemangioma. So these three differentials will be including with focal nodular hyperplasia. If you want to narrow down your differential, ask the history, take the relevant information, look for the previous imaging, look for the previous investigations, laboratory investigation. Any other previous information or medical record will help you to narrow down your differentials. But this is already a narrow differential including hepatocellular carcinoma, hepatocellular adenoma, and hemangioma.